This training will give a basic overview of clinical issues concerning substance use disorder. This training is not meant to be prescriptive or to offer a clinical diagnosis. If you or someone you know has been affected by a substance use concern, please contact a medical or psychiatric professional or call your local 211 for guidance and assistance with community resources. The purpose of this training is to highlight the clinical concerns as it relates to substance use and to build awareness of how it affects individuals. To begin, a mental health disorder is anything that involves changes in a person's thinking, perception, mood, and or their behavior, and it affects how individuals are able to relate to others, build healthy and meaningful relationships, make healthy decisions and choices, and it can severely impact their day-to-day functioning. A substance use disorder is the second most commonly diagnosed mental health disorder in the United States. It occurs when there has been recurrent use of alcohol or drugs that causes significant impairments in an individual's life. The National Institute on Drug Abuse defines addiction as a chronic and relapsing brain disease that is characterized by compulsive drug seeking and use, despite the harmful consequences to an individual's life and in their family, and with meeting their obligations. It is considered both a complex brain disorder and a mental illness. There are different models of addiction and treatment that theorizes the reasons and contributions that lead individuals to use and what the effective treatment measures would be that are most beneficial to individuals. To begin, the moral model is a historical model based on the theory that addiction is a sin and failure to do what is right. It theorizes that individuals are considered morally weak as addiction is a fault of a person's character. This model has contributed to traditional methods of recovery that are more punitive in nature, such as the criminal justice system. The idea under this model is that the approach to recovery is to motivate people to behave better through punishment and to strengthen their will and decision making skills. The spiritual model of addiction theorizes that addiction has been caused because of a disconnection with the higher power, whoever you perceive them to be. And it is suffering because of that failure to live according to God's will. Through this model, recovery is established through reconnecting with God or a higher power. Techniques that individuals utilize under this model tend to be prayer, meditation, the use of spiritual advisors, or connection with one of the most popularly known recovery programs, Alcoholics Anonymous, or similar 12-step groups. The medical or public health model of addiction theorizes that individuals who use are self-medicating their painful stages. These addictive behaviors are coping mechanisms that are used to medicate or self-soothe whatever the underlying physical chronic pain is or the underlying mental health problems, which includes but is not limited to underlying trauma, depression, anxiety, or other types of mental health issues. The public health model is based on the concept that recovery is gained through harm reduction, and it aims to reduce the harms brought about by certain types of drug through a range of intervention approaches. The cognitive or social learning model of addiction theorizes that addiction is stemmed from having painful and negative core thoughts and beliefs, and that it is a learned behavior over time that results from conditioning, modeling, and thinking about certain substances. It further theorizes that individuals who have addictive qualities have a lack of healthy coping skills that increases their risk of continued use. Recovery is achieved through the use of cognitive therapy that approaches and challenges these negative thought concepts and uncovers and replaces unhealthy systems of beliefs while also teaching individuals healthy coping mechanisms to deal with psychosocial stressors. The sociocultural model of addiction theorizes that addiction is caused because of negative effects of culture and society. It further theorizes that addiction can also be an effect of culture due to an individual's living circumstances, deficits in opportunities, stressors, and the socioeconomic state of the environment. It also denotes that groups who are culturally and socially disadvantaged are more likely to experience substance use problems due to the psychosocial stressors they are impacted by in society. The biopsychosocial model of addiction first says that not everyone who uses is inherently bad or will go on to have an addiction problem. It theorizes that one, there are some individuals who are more biologically prone than others to use or to return to using certain substances. It further says that the psychologically rewarding behavior of using certain substances will continue to encourage a person to use and to keep using, especially if there are no immediate negative consequences to their actions. The peer and social influences are also a strong determinant in an individual's decision to use and continuation of using substances or alcohol. The disease model of addiction is one of the most widely and popularly used theories in the field, and it theorizes that individuals with addictive qualities have been caused by either biological, behavioral, and environmental factors, as well as individuals can also be genetically predisposed to developing a substance use disorder. It is recognized in the field as a chronic and, in some cases, lifelong and possibly even fatal disease that affects the functioning in the brain, the person's behavior, and in their physical body. If untreated, substance use can impact an individual's physical and mental health. The early stage of use may have initially been a choice by that individual, but once the brain has been affected by addictive qualities through the introduction of certain drugs, individuals can go on to lose control over their behavior, which then can result in continued and increased risk of use. The level and severity of treatment for individuals ranges based on their personal need. Clinicians who make diagnoses of a substance use disorder are usually looking for certain criteria to make sure that an individual has a substance use concern that is causing significant impairment in their lives. These are some of the criteria that individuals look for based on the DSM-5. To diagnose a mild substance use disorder, individuals only have to meet 2 to 3 of the criteria listed on the screen. To diagnose a moderate substance use disorder, individuals must have met 4 to 5 of the criteria. If an individual meets 6 or more criteria, then a diagnosis of a severe substance use concern could be made. It is important when making any diagnosis as a clinician that other factors are taken into place, as well as there is a history of use and individuals are interviewed as to the impairment that that use is causing in their lives and in their day-to-day functioning. A substance use disorder is something that affects a person's ability to function, handle the difficulties that may come up in their life, and relate to others in healthy ways. An untreated mental illness can increase the risk of an individual developing a substance use disorder, especially if they have no healthy coping mechanisms to deal with the stressors or the symptoms of that mental health disorder. Alternatively, substance use and continued and increased use can risk the development of a mental illness, even if the person had never been predisposed to any mental health illness before. There are several mental health concerns to take into account with individuals who have substance use concerns. For a lot of individuals, the alcohol or drugs are sometimes used to self medicate other symptoms, and unfortunately, the substances can go on to cause side effects and, in the long run, worsen the very symptoms that they felt that they were relieving. As stated before, alcohol and drug use can increase underlying risk for mental disorders, and these can also be caused by a complex interplay of genetics, environment, and other outside factors. However, using some substances can sometimes trigger the manifestation and onset of these symptoms. Alcohol and drug use can also cause a mental health problem to worsen because it may sharply increase the symptoms or trigger new symptoms. And it can also interact or counter interact with medication that is used to treat mental illness, such as antidepressants, anti anxiety pills, and mood stabilizers, which will make them less effective in treating the symptoms. There are several dual diagnosis concerns that must be taken into account for individuals that are facing substance use concern as well as a mental illness. There are problems and consequences that are often associated with dual disorders, which includes, but is not limited to, homelessness, financial problems, isolation and social withdrawal, high risk behavior, especially while driving or utilizing tools, employment or school problems, involvement in the criminal justice system, family problems or problems in their intimate relationship, untreated psychiatric illness, which can contribute to an alcohol or drug relapse, psychiatric symptoms that may be covered up or masked by the alcohol or drug use, increased emergency room admissions and increased need for healthcare services, multiple admission for their chemical dependency services due to relapse or for psychiatric care, and alcohol or drug use or the withdrawal from those can sometimes mimic or give the appearance of some psychiatric illnesses. There are different stages of change when it comes to recovery, and it's important to meet the person where they're at, depending on the stage in recovery. Pre contemplation is the stage where individuals are not thinking about any type of change or have rejected the idea of change because they may not have any concept that their alcohol or substance use has been causing any problems or impairment in their lives. Contemplation is an ambivalent stage where the person may be thinking and talking about change and may seek out support or advice from individuals, but aren't necessarily making the actual change to stop their use. Planning is when the person makes the effort to take the steps to making that change happen and put strategies in place on how to reduce or abstain from their substance use problems. Action is when that person has taken positive steps in putting the plan in practice, such as seeking treatment, asking for help, using medication if necessary. Maintenance is the stage when people are in full recovery and they are achieving positive development and continuing their recovery with support. A relapse can occur at any level in the stages of change in recovery. And a relapse is when somebody may fall back into their old patterns and actions and behaviors. Each relapse is met with new insights and knowledge, leading to less frequency and setback. And the importance of a relapse is that it can help a person to realize what their triggers are that may have led to their use, and or it can teach them different coping skills that didn't necessarily work before that they can utilize in the future. Recovery is a process of change through which individuals can improve their health and their wellness, live better lives, and strive toward their full potential. The process of recovery is not a straight line, but one that may have bumps and curves, yet it is important for a person to realize that it may take different interventions towards their recovery. These interventions can include clinical or psychiatric treatment, medications or medication assisted therapy, faith based approaches, peer support, family support, self care, and other interventions. Recovery is continual growth and improvement in one's health and one's wellness that may involve setbacks or relapses, but recovery never ends. Some of the core principles of recovery based on the SAMHSA's definition is trauma informed care, culture and diversity, which needs to be taken into account because individuals have different needs based on their intersectionalities, peers and family. The more supported an individual is, the more successful they'll be in recovery. Giving an individual respect and hope for the future and hope that they can do it. And being person first. An individual is never defined by their diagnosis, but they are a person first. And it's important when we are interacting with individuals who may need support and help that we recognize them as human beings rather than by the labels which they are diagnosed with. For more information or for more trainings, this is my contact information. Please feel free to reach out if you have any questions and or concerns.